Features and management of local and systemic diseases of dental relevance. Principles of pathology. Anaphylactic shock and acute allergic reactions. Immune system and autoimmunity. Inflammation, protein synthesis and the development of edema. Etiology and clinical features of benign and malignant tumors. Oral microorganisms, principles of identification and their role in oral health indices. Clinical pharmacology. Antimicrobial agents, mode of action, toxicity, resistance. Mediators of pain and inflammation, peripherally and centrally acting analgesics, anti-inflammatory agents. Local anesthetic agents and vasoconstrictors. Intravenous and inhalation sedation. Coagulants and anticoagulants. Basic principles of drug dosage and the administration, distribution, metabolism and excretion of drugs. Side effects of drugs, drug interactions especially in dentistry. Prescribing and legal implications, misuse of drugs, abuse and addiction. Drug addiction, acute withdrawal symptoms. Therapeutic use of hormones. The dental management of medically compromised patients, including those with basic neurological and psychological conditions and organ transplant patients. The impact of radiotherapy plus or minus chemotherapy on the dental health of head and neck, cancer and general oncology patients. Medical emergencies in dental practice and their management. Pathology of the orofacial region. Diseases of the oral mucosa, infections, swellings. Pigmentation, ulceration, dermatoses, precancerous lesions, neoplasms. Diseases of salivary glands, functional, infective, autoimmune and neoplastic. Squamous and basal cell carcinomas. Diseases of bone, especially of the jaws, including infections, cysts, neoplasms, fibrosis. Lesions, endocrine and metabolic disorders. Diseases of paranasal air sinuses. Orofacial manifestations of systemic diseases. Systemic pathology. Acute respiratory distress, asthma and laryngeal obstruction. Respiratory disease, chronic, obstructive and infective. Respiratory failure. Diseases of red and white blood cells. Anemia, thrombosis, ischemia and infarction. Hemorrhage and shock including causes and management. Cerebrovascular hemorrhage and stroke. Angina, myocardial infarction, cardiac arrest. Infective endocarditis and bacteremia, including prophylaxis. Heart failure, viral hepatitis, cirrhosis and liver failure. Neurological conditions including neuralgia, palsies, epilepsy, migraine, Parkinson's disease, dementia, HIV and related infections. The diabetic patient, acute hypoglycemia and diabetic coma, the control of blood sugar,